in the region of the Americas, there have been an increase of dengue cases. Uh, the latest stats would show that you probably have more than 5 million cases across the region of the Americas. Brazil is one of those countries that have been severely affected, and as well as Peru. Dengue, as you know, is a mosquito-borne infection, and it's caused by the dengue virus. There are 4 types of dengue virus, and for simplicity, they're named dengue virus 1, 2, 3, and 4. Now, why that is important is that if you were infected with one type of dengue virus, it doesn't give you immunity for the others. And very often, if you were infected with one type of the virus and then subsequently got infected with another type, then for those patients, we see that they have a more severe form of dengue. Clinically, what we have noticed is that the dengue disease, if you like, once you're infected, a person would go through 3 phases. The first phase is a febrile phase, and that can last maybe from 1 to 3 days. In more extreme cases, it can go up to 7 days. In that first 3 days, people would have symptoms of fever. That's why we generally call it the febrile phase. For most people, that after that 3rd day, fever would subside, they'll start getting better. But for some people who get the more severe form of dengue, you move from that febrile phase into what is called a critical phase. And that can last between 24 to 48 hours. During that period, what is happening in the body, you will have plasma would leak into various parts of the body. And that can result in severe dehydration of that person. And plus you can have bleeding. So the person then goes into shock if they're not treated appropriately and in a timely manner. They can go into shock. And we also see various forms of bleeding in that person. And you can see signs of that by changes in the skin. So you can have spots on the skin, rashes, and so forth. And some people might be vomiting blood. Others might complain of abdominal pains. And if somebody goes to the toilet, you can see dark stool, which is also a sign maybe that they have internal bleeding. People's skin generally becomes very pale, so you know that they have some form of bleeding and blood loss. So that's the critical phase. And it's important that if anybody is experiencing any of these signs or symptoms, that they come urgently to the hospital so that the medical professionals can make an intervention. And then once that phase subsides, you go into a convalescent phase, basically meaning that you're recovering. And that can take a couple of days to a couple of weeks, depending on how severe you might have had the disease. Now, for this year, we were able to do approximately 11,240 tests so far. And of those tests, we have identified 2,852 persons who have tested positive for dengue. And of those persons who have tested positive, we have seen 265 of them needing some form of hospitalization. We have had, so far for the year, we have had 2 deaths resulting from dengue. The regions that are affected would be regions 4, 2, 10, 6, 9, and 1. And so we continue to have intensive monitoring of these regions. Now, since it's a mosquito-borne infection, the way that we can prevent the transmission of dengue is to make sure that we kill the mosquito. Now, how can we do that? Well, one way is to fog various breeding sites. And we have intensified fogging in almost all of the regions. We have teams that go out and do the fogging. And mosquitoes have a particular time in which they would be more active. So in the evenings, that's the time when they're most active, and early in the mornings. So our teams would generally go out in the evenings to do the fogging and then early in the mornings. So right now we have various teams across the country doing this. The ministry, we have bought a lot of the chemicals that are needed for fogging, and we have a number of fogging machines, and we have deployed them with staff to the different regions. So by doing that, we would see that the vector that is transmitting the virus would decrease. This week, we have started to see a decline in cases. So that's a positive side. And that's because of the fogging activities that we have that are ongoing. We have also, another way that we can impact on the mosquito population is to make sure that the larvae that you have in stagnant water, that we are able to kill that. So we have a chemical that is a larvicide. It's called Abate, and we have also been distributing that to various communities, various regions, and encouraging people to put that into stagnant water. So if that is a breeding site, then we can kill the mosquitoes. So these are measures that from the ministry, from the region, from the government that we've been taking. But people themselves can also take measures. And if you have stagnant pools of water in and around the place where you're living, then you should help us to remove those stagnant pools. If your community, if there are lots of mosquitoes in that community, you can use insect repellent and so forth. So there are things that you can do to prevent being bitten by these mosquitoes, because we wouldn't know which one is carrying the virus or not. So it's better to take these precautions by preventing getting bitten by mosquitoes. So these are the standard things that we can do, and I hope that people would take these precautions very seriously. Now, one of the things that we have noticed is that persons might get fever, and they would attribute that to getting flu, so they don't bother to come to the health center, to the hospital. If you have a fever, we are encouraging people to come to one of our facilities so that we can test you, because you don't know what is causing the fever. And we can test you, and then we can advise you accordingly. Another thing that if you have fever and you don't know whether you have dengue or not, then if you get a fever, it's advisable not to use aspirins, because aspirin would contribute to bleeding. So if you have a fever, the best thing to use is paracetamol. And that, paracetamol, one of the side effects, it doesn't have this bleeding as a side effect. Aspirin does have that as a side effect. We have been working very hard. I mean, there's no specific treatment for dengue, at least in its mild form. As I said, in most places, you advise people to use paracetamol. We don't want people to be dehydrated, so we encourage them to take a lot of fluids. So that's in the mild form. If you have a more severe form of dengue, and maybe you're getting reinfected, then we'll want to see that person come to the hospital. And if we detect that they have any sign of dehydration, then we can give them fluids. If they are going into shock, then there are measures that the doctors would take to prevent shock from happening. And if you have bleeding with some of the signs that I mentioned, then there would be specific interventions that the doctors would take to make sure that we can help that patient. On Friday, actually, we are starting a mosquito net distribution program. These nets would have insecticide on them, long-lasting insecticide. But we're using them more in regions 1, 7, 8, and 9 because apart from dengue, we are using them to prevent malaria. We have two types, those that can go on the bed, and we have hammock nets that we've been using. So on Friday, we'll start that distribution in Region 9 to combat both dengue and malaria and other mosquito-borne infections. People should be cautious, and especially with children, if they have fever, don't take for granted that they have flu. Just bring the children to one of the facilities to get tested, and so that you can be properly advised by a professional. So don't assume anything. Make sure that the children come in, because with a professional checking the child, they might detect other things that someone who's not trained would be unable to detect. Testing is widely available. We have thousands of rapid kits that we have bought, and we have made that available across the system. So in some of the affected regions, we have given them extra kits, and we've asked them to distribute them widely so that people can come into the health centers and get tested.